ACS CAN in particular is focused on advocacy, so they work a lot with legislators and any elected officials at all levels, municipal all the way up through federal, and they really are the ones that are literally lobbying for significant changes to address cancer. American Cancer Society Cancer Action Network has supported eliminating co-payments, for example, related to colorectal cancer screening. That is a very direct part of access. Another piece of legislation that was supported recently has been biomarker testing. Because of the science advancing as fast as it has, we're able to basically profile tumors in a way that you can tailor the drugs that are effective based on the characteristics of those tumors. That's called biomarkers. So access to those tests is something that the ACS CAN has actually supported.
So I've been a volunteer for 25 years because I have never found a more passionate group of people who, when they come together to fight the enemy, which is cancer, they have so much power, it's contagious. And with ACS CAN, I just completed my term as the California State Lead Ambassador. The State Lead Ambassador is the chief volunteer for the state, motivates, helps do training, speaking to get volunteers ready for our Cancer Action Days, where we meet with elected officials in the Assembly and in the California Senate and their staff. And so the lead ambassador leads those meetings when we convene as a group, and we prepare to have those conversations. Many people have never done anything like this before, and we give them the tools, the resources on how to tell their stories so that they can do that in an impactful way that can help persuade a legislator to change their position or help others get on board with our policy.
VIVE stands for Vidas Importantes, Vecindarios Elevados, and it's an American Cancer Society Cancer Action Network, ACS CAN initiative to bring community, in this case focused in Imperial County in Southeast California, really bring a community together to address cancer, and in this case also specifically with an emphasis on tobacco control. That initiative is really bringing the community voice to the problems that are being faced, and with a focus on tobacco and the Latino man being an average tobacco user, there are lots of opportunities there to really begin to ask the question, well, what can we do that is going to reduce tobacco use among Latino men in particular, and really try to make the link between the tobacco use and screening, for example.
And there's no better way to get engaged than just call up ACS CAN or go on our website, fightcancer.org, and sign up. And you will be contacted by a real person who wants to get you engaged. And so I do this work. My spouse says that I've defied death twice, the first time with cancer and the second time with a stroke, because I have more work to do. So I can't stop. I have a purpose, and my purpose is to join with others in this fight to make cancer not a death sentence, but more like a chronic disease, something that's treatable, something that people can live with as opposed to die from. And until that happens, I'm hoping I live long enough to see it happen. I'll continue my volunteerism with the American Cancer Society and the ACS CAN.